Hello, my name is Sylvia Maxwell. I'm enrolled at Altamaha Technical College under the Business Office Technology Diploma Program with the concentration of Medical Office Specialist. Today I will be doing my English final presentation under medical coding and what are the requirements of medical coding. First, I would like to start off explaining what is medical coding. Medical coding is the transformation of narrative descriptions of diseases, injuries, and healthcare procedures into numeric or alphanumeric designations, that is, code numbers. The code numbers are detailed in order to accurately describe the diagnosis, that is, what is wrong with the patient, and the procedures performed to test or correct these diagnoses. Because medicine is not always an exact science, codes were developed to identify all reasons for seeking healthcare. The job duties of a coder is to collect data, to submit insurance claims for reimbursement, document medical services performed using correct medical terminology, to extract information from the documentation physicians provide in the patient's chart and convert it to what is known as a CPT code. A CPT code is a 5-digit number developed by the AMA, the American Medical Association. The codes are then submitted for payment. A medical coder's main goal is to provide billing services so that the health provider gets paid for medical services rendered. Every medical service is assigned a numeric code to define diagnostics, treatments, and procedures. It is the coder's job to enter this information into a database using this set medical protocol to produce a statement or claim. The claim is then sent to the appropriate insurance carrier where it is either accepted or denied. If accepted, the health provider is reimbursed accordingly. If the claim is denied, the medical coder must investigate the rejected claim, verify this information with the health provider, and update the new details into the database. A bill is then sent to the patient. Medical coders are also responsible for dealing with collection and with insurance fraud. Skills. They must be able to effectively code medical data. Medical coders must know the appropriate medical terminology. They must also have keyboarding skills and the ability to operate the software packages and its updates. Coding specialists must develop efficient and accurate billing and coding skills to ensure that they keep the healthcare industry profitable while not making mistakes that can cost the healthcare money and harm to the patients. Training. Coders must attend school to have certification to work in this profession. Before attending a program, the coders must have at least a high school diploma or one equivalent. Sometimes a medical coder professional must have the on-the-job training and work experience before getting certification. Some of the medical coding programs provide training through local vocational schools, while other programs train students online. It is very difficult to enter a career in medical coding without receiving the appropriate training and education from an accredited university, community college, or vocational technical school. The best training you can receive is often through medical coding certificate programs offered at these types of schools. Many online medical coding certification programs will also require that you take an introductory course to online learning. These introductory courses familiarize students with the software programs necessary to participate in an online learning format. Something else to keep in mind is that many medical coding certification programs include a practicum that may include an internship at a local hospital, doctor's office, or a clinic. These internships may require participants to undergo a criminal background check. Some of the do's and don'ts of a medical coder. Do code only what the medical record says. Do know the appropriate medical terminology to the procedure you are coding, and do not alter medical records for any reason. According to rules of medical coding, if it's not in the record, it wasn't done. Medical coders can't code based on what they know physicians and nurses did, and this can affect reimbursement in a negative way. Medical coders, what they can do is contact the physician and ask for a review of the record to make any changes that are necessary for keeping record purposes, but not for reimbursement purposes. Conclusion. In conclusion, it may be easy to make mistakes as a medical coder, but with the techniques that I have outlined, that will help you avoid them if you follow each one of them detail to detail. Thank you again.